Hi, this is Mackenzie. So for my clinical experience, I was at the Medical Center of Aurora, and I had a really good experience. I felt like I learned a lot. So some things I identified as strengths were that I effectively communicated with both the nurses as well as the patients. So I made a point of when I showed up for the day, when I learned what nurse I was assigned to, I'd ask them if there's anything I could do to make their life easier and their day flow more smoothly. So I helped answer call lights, and then whenever we went into a room to do an assessment, I just automatically grab the vitals cart and start taking vitals. And then for family members and patients, I'd always introduce myself as a student nurse, but kind of reach out to them and let them know that I too could help them if they need anything. And I think just taking that moment to make a connection really helped, because then people would ask me hey, can you grab me some ice? Can you grab me some water? And kind of it made it easier for my nurse, and then it also helped me work on establishing better patient-student care. And then I also advocated for new experiences. So I saw an anesthesiologist going into a room to do an epidural, and I was like, hey, can I come watch? And we made sure it was okay with the patient, but it was an awesome experience. I got to see an epidural placement. I also got to see a vaginal birth as well as a C-section. I did an IV placement, and then also got to do a baby's first bath. And then another strength would just be asking a lot of questions. So I didn't feel very comfortable with fetal, looking at the strips in class, and so just kind of seeing it in real life and asking nurses what are you looking for, and just getting additional feedback and having more exposure really helped with my confidence. And then when I was in the NICU, I was actually working with a nurse who also was a lactation consultant, so just getting to pick her brain on her job was really helpful. Areas of weakness I identified were just kind of being unfamiliar and lacking comfort working with neonates. I know when I was giving my first bath, I was carefully scrubbing the head, and my preceptor was just you can just grab it and be a little bit more forceful with that. And so I think that's something I can work on improving on, and just kind of, while it's good to be cautious, just work on gaining more comfort and confidence in working with smaller kids. And then kind of tailing off that, practicing doing vital signs for neonates, because their hearts beat so fast. I know initially when I started doing them, my counts would be different than my nurses, but then as the day progressed, I was getting better. And so I think I felt that after I kind of started tapping my foot like we talked in class, that really helped me keep the rhythm. But that's something that I want to continue practicing. And then another weakness would just be getting more hands-on experience. I know when I was starting the IV, I could have anchored my vein a little bit better. I was doing a hand vein, and those especially need better anchoring. And then when I was kind of doing a debrief with my clinical scholar afterwards, she gave a helpful hint that when you're going for veins, it's good to kind of anchor down, and then when you see where they bifurcate, go a little bit more distal to that, and usually you get better success. And so kind of applying that moving forward would be really helpful. And then for future applications and learning, I think just continue asking questions. I learned a lot from just talking to the nurses. They have so much insight. A lot of the people I worked with had been working at the hospital for 20, 30 years. And so they knew a lot. They definitely knew their stuff. And so it was fun asking them questions. And then just advocating for new experiences. I think that the more hands-on you get and the more you see and the more you do, it betters you as a nurse and then increases your skill level. And then I think, again, just letting patients know that even though I'm a student, I'm available, I'm here for you, please let me know what I can do. Because just giving them, letting them know that you're not there just to watch really helps them reach out and ask you to help them with things too. Thanks.